HIV and AIDS. Human immune deficiency virus. That is the virus which create deficiency and create inefficiency of the immune system by attacking and damaging the process of immunity. This is a single-stranded RNA retrovirus. So it is called as retrovirus because it is converted from RNA into DNA inside the T cells. When it enters in the bloodstream of the human being due to contaminated intercourse, when the either sex partner is HIV positive, there is transmission. This is route of transmission of this virus into the bloodstream of the normal person. Then this virus travel through the bloodstream and enter in the CD4 and T cells. Inside the cell, the RNA transform into the DNA and then enter in the nucleus of the T cells. There it command and send message to produce the protein specific for the replication of this virus, retrovirus. So this is the pathogenesis. Millions of the viruses are produced by repeated replication inside the T cells, due to which there is damage and death of the T cell and the other immune cells, CD4, plasma cell, macrophages, monocytes. They are killed, damaged, and when the force of the virus or the count of the virus is enough, the immune system is defeated. It cannot counterattack the sufficient or excessive amount or the count of the HIV. So there is production of cytokines, chemokines, which produces inflammation in the various organs of the body. So multiple symptoms are produced related to the organs which are damaged or diseased one. That is why it is called as AIDS, acquired immune deficiency syndrome, not disease, because it is a collection of the symptoms of the various diseases produced by this virus inside the human body. So the virus undergo replication, the virus load is increased, whereas the CD4 or T cell count is decreased constantly. So this syndrome has three phases. First phase, when the count of the CD4 cells is near about 500 microliter. Second phase, when the count is near about 300 microliter. When this count of the CD4 cells falls below 200 microliter, then this is the stage at which we call it the infection has converted into the AIDS, acquired immune deficiency syndrome. At this stage, the defense mechanism, defense capacity of the body of the patient is negligible, is sufficiently decreased. It cannot, it cannot fight against the various other pathogen which enters or get chance to avail the weakness of the patient. Certain other pathogens of the disease they enter. For example, there is pneumonia, TB, lymphoma, sarcoma. Then there is other diseases, COPD. So these diseases they also come into action along with the AIDS. So at this stage, the opportunistic diseases they also come into play. So due to which the weakness is severe, patient is unable to perform his duty, unable to eat or drink. There is weight loss, chronic diarrhea, other symptomatology, that is there is enlargement of the liver, spleen, then there is peripheral neuropathy, encephalitis, meningitis, nephropathy, cardiomegaly, and cardiomyopathy. So there are various other diseases they come into action, due to which the person is near about death. At this stage, it is difficult to save the life of the patient. But if it is diagnosed earlier and the ART, antiretrovirus treatment, is started earlier, then we can save the capacity and ability of the and boost up the immune system by these medicines, and we control or we reduce or cut off the replication of the HIV. So the virus count is controlled and is brought near about zero level. On the other hand, the immune system is boosted up, is strengthened and become powerful to come into action and attack the and various pathogens which has entered in the body to get chance due to the overload of the HIV. So these medicines they are efficient to boost up the capacity of the CD4 and T cells and other immune systems and cells, and they also reduce the multiplication or replication or increase in the count of the HIV in the body or in the bloodstream. Now diagnosis: antibodies and antigen against the retrovirus, antibody produced by the immune system, and the antigen, that is the count of the virus in the bloodstream, is estimated and calculated by ELISA methods. And the count of the CD4 cells, that is also calculated, because the treatment efficiency is also estimated by the increase in the count of the CD cell and decrease in the count of HIV in the bloodstream. So this shows the action and efficiency of the ART drugs. Now, the various mode of transmission, in addition to the sexually transmitted routes, there is also sharing of the contaminated syringes by the by the drug addicts, and also vertical transmission. If the pregnant or woman is HIV positive, then it will transmit the viruses through the placenta to the baby during pregnancy, also during the labor stage. And moreover, this virus is also present in the breast milk. So the tests, they are compulsory for the pregnant woman. If they are positive, then ART drugs should be started to make them near about negative, or the near about negative position, to save the baby life. So these are the various diagnostic and the pathologies produced during the last stage, that is the AIDS phase of the infection. So HIV is a virus which produce immune deficiency in human body, and AIDS is the acquired immune deficiency syndrome which is produced by this virus in the long run. So it is a long lasting disease or syndrome, which is a very insidious process, because it may take more than 10 years to become the AIDS. So during this period, screening of the sex partners is compulsory. Screening of the pregnant mothers is compulsory, so that earlier treatment by the ART is provided to make the baby and the sex partner safe from the HIV hazards.